health funding. Establishes a $50 billion rural health transformation program over 5 years to support rural, R-U-R-A-L, rural healthcare providers. This one is new, focused on initiatives designed to improve care access in rural areas. All right. Now, those are really much the main points for the Medicare plan. SNAP, for those of you that receive Supplemental Nutrition Assistance Program, SNAP, primarily focuses on expanding work requirements and shifting costs once again to states. All right. Your federal government is saying we're tired of footing the bill for everything, and then your state reps go in and spend all the money on non-U.S. citizens, because that's what's happened, especially in Illinois, New York, California. All right. Those are the reasons why those mayors were held in court earlier this year and had to go speak in front of Congress and Senate. Our states are affected the most. Okay. So SNAP reform. Again, for people who think that illegal immigrants are not receiving SNAP benefits, you are wrong, because yes, they are. And in the city of Chicago, they are receiving thousands of dollars of SNAP benefits. All right. Expanded work requirements. So now they are making sure, and everyone has to, a lot of people always had to work on SNAP anyway, right? They raised that requirement for a lot of you all to work anyway. But now it raises the maximum age for the able-bodied adult. And they keep saying this all across this bill. Able-bodied adults. I want y'all to be clear. They're not taking off your senior grandmama that's in her 70s. They're not taking off your disabled child. They are specifically talking about the able-bodied adults that depend on the government. And let's be clear, y'all know a bunch of cousins that's been on these benefits for decades. It's in 5 generations on these, okay? Y'all know them. And this is cousins in every race and nationality. Because let's be clear, black people are not the highest ones on SNAP and Medicare. You are not the highest population. White America is. That's a fact. All right. So whites are number 1. Blacks are supposed to be number 2. Then Hispanics, then Asian. But, all right, let's be clear. Right now, with the numbers, blacks actually fall to number 3. Hispanics are going to be getting more. Again, because if they qualify under the illegal immigration, not illegal, if they qualify or came in under immigration, a lot of these countries, right, that we opened up to, Venezuela, Nicaragua, Haiti, right? You have 7 different countries here, all right? So depending on what they consider themselves and class themselves as, that's what it's going to be listed as. But the expanded work requirements are going to now require millions of older and vulnerable low-income individuals are now subject to a time limit. 3 months of benefits in a 3-year period unless they meet that 80-hour per month work requirement. So again, they changed the rules from it being 54 to now you have to be 64. They have included an additional 10 years. So people who were 54, who were under 54, were able to acquire these benefits. Now they're pushing the age requirement up to 64. So between 54 and 64, you're not just getting the benefits. You now have to work and you have to do these 80 hours a week. I'm sorry, 80 hours a month is what it's showing. 80 hours per month is the work requirement. Again, the work requirement can be volunteer. It doesn't necessarily have to be a job. But what they're saying is if you are able-bodied, and this is what it states here, able-bodied, I'm looking at the actual section code. I'm going to give you the whole Congress bill. It's congress.gov, bill 119th, okay? The code for the bill is HR 1, One Big Beautiful Bill Act, all right? You can look that up. HR 1, 119th Congress. It's called the Big Beautiful Bill Act. That's where I'm reading from. All right. So many of you won't read. Many of you won't go dig this deep. So that's why we're on here tonight. All right. So like I said, it went from the age of 54 to now 64. So all of your seniors that are up to that age, they now have to have a 80-hour per month work requirement. Now, they will give them a 3-month trial is what it's saying. They will get 3 months of benefits, but if they do not show that they have worked 80 hours per month after that 3 months, they will not be able to be on benefits, SNAP benefits for a 3-year period. That means they are blocking you for 3 years. Not 6 months, not a year, not 2 years, but 3 years. That's 36 months. So I would pay attention and start letting some of y'all parents and grandparents know that this is required if they are able-bodied. So if they're not able-bodied, if they are disabled, most people who are disabled, you have paperwork, you have proof to show that you are disabled. So if you don't show that, they are going to consider you as able-bodied adults. All right? ABAWD is the short term for it. Able-bodied adults without dependents. That's what this is. Excuse me. It also removes exemptions for veterans, people experiencing homelessness, and foster youth. It also removes exemptions. So those were exemptions before. If you were a veteran, if you were experiencing homelessness, if you were a former foster youth, it removes those. Now that's saying that those people are included in this new bill. Again, something to think about. This is the